partnerships, as we talk about unusual suspects coming together around children's health, that we ask someone who's been part of our work with Great Start Collaborative Wayne to come and do that introduction. And that is our friend and colleague, Deb Strong. Many of you know her. She is joined at the hip with us as well. Deb, if you would come up and give an introduction. Thank you. And if we could, all of us who work with Deb, let's give her a round of applause.
Good afternoon. I am so pleased to have been asked to introduce someone that has been not only a partner with us on this initiative or this journey that we're talking about today, but for a long time has been in the field fighting with his pen on this issue. And I have been asked to introduce Jack Kresnick, as Jametta said, the president and CEO of Michigan's Children, which is one of the premier advocacy organizations in the state. Not only have, if you've not heard about them, you might have heard about some of the products or the pieces that they are connected with. Along with Michigan League of Human Services, they produce Kids Count. I don't think there's an organization in this state who has not used data from Kids Count. That's a piece that we can be very proud of. I also know that those people who watch the budget and want to know what's happening with children's issues, the Budget Watch piece that comes out of Michigan's Children is another valuable document that's important. Policy papers that cover a range of issues that impact on children is another one. And then a fourth area that I think is really important that you may not know about the Michigan's Children is this issue about a voice for children, bringing kids together so that they can share their issues, their concerns themselves, giving them a voice in other ways, not adults speaking for them, but them speaking for themselves. But when I try to introduce Jack, my history with Jack and his work goes way beyond Michigan's Children. He was, for 38 years, you may also know him as a Free Press writer. And for 38 years, he was with the Free Press, 20 of which he dealt with children's issues. And during those 20 years, of all the different places I have been, I can think of no one person, who took their pen and their passion and used it on behalf of kids more effectively than Jack Kresnick. And one of the issues that I was engaged with or dealing with at the time happened to be child abuse and neglect. And when he put his laser vision on these issues in this state and made all of us come up short and pay attention to it, he happened to be the catalyst that brought about significant change in the state in policy and programs and services to that population of kids. And I am so thankful that he is on this journey with us. We have lots of champions here, but there's no better champion, I believe, than Jack Kresnick, who has been here in the trenches as well as now leading the helm of an organization to help keep us abreast of what's going on with kids and being that voice. Thank you.
Good morning, everybody, or afternoon now. I usually take my hat off, but I'm known for my hats and my children's ties. It gives me a little recognition in Lansing and elsewhere. But I kept it on for a minute because my hat's off to Jametta. Literally, figuratively, for getting the funding for the WCHAP program to get this pilot project going. It is so important for the children of our city and our county to make sure, especially in those early years of childhood, that they get adequate care. A medical home for these children is a critical component. In the mid-90s, I covered juvenile justice, and I wrote a few stories about the decrepit Wayne County Youth Home. Many of you have been there. What a pigsty, what a pit, what a dangerous place for children it was. Lots of hidden corners where bad things were happening to kids. Pricking the conscience of Wayne County did the trick. About 98, they opened a new Wayne County Juvenile Detention Facility that is state-of-the-art, and when I say state-of-the-art, I mean it. They have 7 gymnasiums, a medical clinics, mental health clinics, dental clinics, And out of that positive news came the realization that for many kids in our county, their first access to dental care or adequate health care or mental health care came because they got arrested. And it's a shame on us that we weren't able to provide those services to all children, and we have to get them into custody before we will provide publicly funded care for our children. It was an outrage. It is a continuing outrage that so many children in our community don't have access to adequate medical care. And medical home is really the key to how we can really, encircle a child in the family with the proper services as far as physical care, mental health care, dental care, behavioral care, all those things that are so critical, social services that help children get to school, get to kindergarten, ready to learn. We look at the often abysmal test scores for third grade reading and fourth grade math and dropout rates. All of that is not helped when a child does not have access to health care. When a child is struggling with a chronic health issue, that child is not able to learn. And so when we don't fund the programs that provide that, we're setting up those children to fail. And then we wonder why. And we'll blame the teachers, and we'll blame the parents, and we'll blame everybody but ourselves for not making this happen. We worked hard on the reauthorization of the Children's Health Insurance Program on the federal level. President Bush had vetoed that legislation. I was in Washington frequently talking to our members of Congress in Michigan to get that reauthorized to expand medical insurance to millions of poor children across our country, and thousands of them here in Michigan. And we won that fight when President Obama signed that piece of legislation into law in February of 2009. I think it was his first piece of legislation, and we thank the President for doing that. And a lot of people, though, thought, okay, we got children's health insurance covered, we're done. They got insurance, either Medicaid or in Michigan, the My Child program. And even though there are still 150,000 kids in Michigan that do not have any form of health insurance, the kids that have Medicaid and My Child are still having poor health outcomes. And that was the realization that, this job is not done. And we're looking at Kent County, and we're looking at Wayne County as leading the way for really getting the services that all these children need, these vulnerable kids need, wrapped around them and working effectively. It's not enough to say you have Medicaid, but if you have Medicaid and you have no doctors willing to take your Medicaid card, what good is it? And it's no wonder our children are suffering. We're so grateful that Governor Snyder has been talking about thinking about systems in a P20 concept, which he describes as prenatal to age 20. Prenatal obviously being critical to the health of our children, to be born healthy. We have so many, Chris Elliott was telling me, so many young babies born premature in this county. They'll fit in your hand. And their care is expensive. It's not healthy for those babies. They start off life pretty much behind everyone else because their developmental needs are delayed. And so having this prenatal concept going is critical. In those first few years of life, as Judy Samuelson from at ECIC will tell everybody, are the most critical period when children's fates are decided based on their health and safety and whether they come to kindergarten ready to learn. And as we know, too many don't come to kindergarten ready to learn. And they fall behind. They're more likely to repeat grades and to drop out. And we know what happens when kids drop out of school. It's basically a ticket to prison. which is a bad outcome for them, a bad outcome for their families and for their communities and for our entire state. We can't continue to lock up children, particularly children of color, at the rate that we're locking them up now and expect to have a future in this state, a future with an economy that works for everybody and not just the few. So without a comprehensive medical home for children, the holistic approach to early childhood is incomplete. Young children from low-income families struggle with many systemic barriers. They have difficulty accessing adequate health care, and that's a major barrier. And the Children's Health Access Program model that they have in Wayne County now, thanks to Jimetta and the Kresge Foundation, and in Kent County, offers a way for young children who are covered by Medicaid to access pediatric services while also supporting parents with their children's health issues. Medical home is a priority for my organization, Michigan's Children, as we advocate for better public policies for our children. So we're relieved, we're excited to see that this is coming to our two largest counties, Kent and Wayne, and that we can really show the rest of the state how to do this. So far, Kent County had a jump start on this. They've been working with foundations and the health insurance industry and medical providers in Grand Rapids area. And they've shown some positive results, including decreased emergency room visits, improved healthcare access, better asthma management. So many emergency room visits have to do with asthma, something I've struggled with my whole life. But you know, for poor families, getting the preventive care to keep those attacks from occurring is not only a challenge, it's often impossible. So the kids end up in emergency rooms, which costs all of us too much money. And integrating and streamlining behavioral health referrals, the process for behavioral health referrals really increases the CHAP's ability to make an important difference on kids. Yesterday, we had a Kids Speak forum where Deborah Strong mentioned we bring the voices of young people to policymakers. We did this in the Capitol with kids who are homeless, kids who are foster kids, kids who dropped out of school and are facing other challenges. But so many of them, time after time, they talked about the emotional and mental health issues that they have where they could not get any help whatsoever. I was really impressed with a 15-year-old girl named JoJo, who was from Grand Rapids, and she said, for 2 months now, I haven't cut myself. She was extremely proud of that, and I congratulated her on that because I know that the deep-seated psychological problems that are involved with a child that purposely hurts themselves is really difficult to deal with. And if we don't have an adequate holistic system that surrounds the child from infanthood to school, we're not going to get very far with our children. Here's an interesting thing. The share of Michigan children who use Medicaid has grown in the last 10 years from 23% to 39%, which is an indication not only of good outreach by the Medicaid program, but also of poverty growing in our state. More and more children are being raised in poverty in Michigan. And 58% of the Medicaid population are children, yet only 19% of the services paid by Medicaid go to children. So here's a disconnect. More than half of the people on Medicaid are children, and yet they only get 20% or less of the funding for the services provided. So the huge problem is getting the providers to accept Medicaid as an insurance program for the kids. And when Medicaid only provides 68% of every dollar spent, that's a lot of physicians are saying it's just not worth it. It's just not worth it to help our kids because our state has decided to disinvest in their health care. So this Children's Health Access Program is critical to reduce